Dr. Varsha Rathi will be talking about the rural eye care model in the diagnostics of corneal disease.
I hope you can hear me. We have heard about so many investigations being done for corneal cases. I would just like to discuss about the rural centers where we have some of the corneal diagnostic procedures, what we can do. We are located in 22 secondary centers, and I would be talking about what we are doing there. So this is a lady who had come to us while working in the field. She was plucking cotton and she had red eye, and she came to us with the red eye, and when we put fluorescein, you can see the corneal abrasion which was shown earlier. So a slit lamp is must along with yellow filters for everyone. And if there is any infectious keratitis, we do have unlimited of having 10% KOH mount or gram stain or punk blue stain, but not the KOH calcoflow white stain. This is, I would say, must for everyone who is practicing cornea or who is doing cornea as a fixed facility at one place. So if you are having multiple centers also, you should have that at those places. What I'm talking about is mobile diagnostic van, which you can have with various, I would say, investigation facilities, so that you can manage patients locally or you can refer them to higher centers. Because information which is gathered here would lead to more tailored treatment for that particular patient. This is 1 year data of diagnostic van where we have done investigations in 8,700 patients. And as you can see, the corneal investigations were done only for 4% of all the investigations which were done were for cornea. Compared to that, the retina were highest, followed by glaucoma, and for cataract we have done certain other investigations. So these were the investigations which we had done from the van: anterior segment OCT, specular and topography. And if you see, the number of OCT is 50%, which includes both retina and cornea. So OCT can be there in the center or in the van. Topography, we have done only 1% from all the cases what we have done. So it is actually a pretty less number of corneal topography. And specular microscopy was not utilized at all. So this is a data, I would say data for 1 year, but then earlier also we had done only 3. So we had removed this from our van and we have put it in a tertiary center so that they can use that specular microscopy machine. Cost is dependent on provider because they would consider many things, who is doing, how many tests are to be done and all that, and how the resources would be utilized. For patient specific, we have to see the context where it is being used. Investigations performed, what are those, with referral, whether it's single or multiple, and also the transport cost and wages for the patients which are there. And clinician's cost can also be included in this. So if you see the medical equipment, it is close to 97 lakhs and vehicle cost is around 13 lakhs. So total cost of the mobile van would be like 1.11. And this is individual. I am giving you just not the companies but the numbers, so that is how we have broken that. So for cornea, you can have OCT, corneal topography, and pachymeter if required. You can do the thickness. And specular microscopy as such is not required in rural centers, I would say, or for that matter, private practice. Expenditure for the van every month was around close to 1 lakh, so that we have to consider. If you remove the vision technician salary who was part of the van and also the administrator salary from this. For patient, we consider transport cost as 10 rupees per kilometer, considering the bus fare, and the daily wages as 400 per day from Indian context. And single trip, then we can call them for annual visit. They don't have to go to the higher center. They can save the money on that. And even multiple trips, they will, I would say, save money on those. Based on the number of investigations what we have performed, if there are lower investigations, we would reduce the visits to those centers compared to the centers where we had higher visits. And we could manage almost close to 75% of patients locally, and only 20% patients were referred. So it is very easy for a person to do the test, decide about what needs to be done for the patient. Because if there is a keratoconus which is progressing, probably they may have to refer for contact lens trial or collagen cross-linking, or they can do the trial there itself as, I would say, rural center or a private practitioner. Faster diagnosis is possible with these because it will reduce time for all, and more efficient treatment can be given for these. Only cornea, if you think just of only cornea, it is very difficult to have cost recovery from the mobile van because not many investigations were done for cornea, and the manpower needed, vehicle issues and breakdown of equipment also needs to be considered. All of us have seen these examples. This is from the diagnostic van, and this is post-op photograph I am showing. So if we have a right test and right time with right interpretation, probably we can help. Like this young girl who had come to us with split reflex, we could see keratoconus. That time the center had just CCT was done, and then later on the patient was referred to higher center after doing corneal tomography and seeing the progression. So patients' visits can be avoided, money can be saved for both patients and for their same multiple visits. They can be managed locally, and locations can be changed based on whether the number of investigations there are done or are more or less. And investigations can be added. Whatever investigations we have discussed today, probably I do not have all those in the system. We may not be having those. Can be done for tertiary centers, and referrals can be looked into, and procedures on mobile vans such as probably collagen cross-linking or with OCT, even retina injections can be done, and they can be thought of. This is a van interior because we have moved van from one place to other. These are the boxes, and these are the, I would say, the van which we use, and this is how the van would go from one center to the other center. Thank you very much.